This is just a cool case that I wanted to show. So the patient history of chronic pancreatitis and came in with abdominal pain. And this was probably like one of the biggest, what do you think? Focus on the stomach.
There's either an ulcer or a focal perforation.
Yeah, this is probably like one of the larger like gastric ulcer perforation that I've seen in a while.
Like Archie's appendix, only it's the stomach.
Right, right. So it's just a little show and tell, nothing, and then just other stuff for chronic findings.
So Nelly, do you remember, I always forget when you see an ulcer, what would suggest more that it's an ulcerated mass versus just a ulcer?
That's a good question.
It's on our boards, but I don't remember.
I don't remember the board's questions, but I would think if there was, I don't know, soft tissue component to it. I didn't see any, but
I don't know. This like the soft tissue looks really thick there, but I guess you're saying that that's like around the ulcer, you know, like that's just edematous.
That's what I thought, but let me follow up and make sure it's not a gastric cancer with perf, to make sure I'm telling you the right thing. Yeah, that's a good question. That's a good question.
Something about if it extends beyond the expected area of the wall versus contained within the wall or something like that.
Do any of the residents have any thoughts about, since they're probably all studying right now?
Like fluoro stuff. So if it's contained within the wall, it's a neoplasm. If it extends beyond the wall, then a benign ulcer feature.
So if it extends beyond the wall, it's a benign ulcer. This one looks like it's extending beyond.
Guys, can you hear me?
Victoria, yes. Hi, Victoria.
Oh, hey, I'm just like I keep trying to talk and I didn't realize it was muted. That looks like a ulcerated gastric malignancy, and I do remember this from boards. If it's a benign ulcer, right, it's supposed to extend beyond the expected contour of the lumen because it's an ulceration that goes into the wall of the stomach, where the malignant ulcer is an ulceration in the polypoid gastric malignancy. You have mass which projects into the lumen, and that mass gets ulcerated so that the ulcer is basically within, like if you pretend where the lumen is, the ulcer is within the lumen. To me, this looks like an ulcerated gastric malignancy. Although I've seen pitfalls where there was so much edema that the mound of edema kind of made the ulceration look like it's inside.
Okay. Well, definitely.
There's also because the malignant quote unquote gastric ulcer is really an ulcerated malignancy. You have clubbing of the of the fold because you have tumor. The folds stop at the margin of the tumor and they don't come up to the ulcer margin, whereas in a benign ulcer the folds go all the way to the margin because again it's the ulcer, there's no mass there, so you just have a hole in the mucosa. That's another one. And then there's Hampton line and Carmen meniscus, but those have to be done on the compression views and upper GI, so there's no CT corollary to that.
Cool. Okay, so this could be malignant ulcer, and that's something that so I will follow up, make sure that the patient gets scoped. That is all I have. Victoria, do you have any cases?